Hi everyone, my name is Nicole Coolbaugh. In this presentation, I will provide a brief introduction to myself and my current interests and goals in the field of public health. I graduated with a mathematics degree from Arcadia University. Though my focus was math, I took a global public health course that inspired me to participate in the Summer Institute for Training in Biostatistics at the University of Pittsburgh, which is a training program focusing on collaborative research, cardiovascular health, and minority populations. After graduating from Arcadia and in consideration of my success at SIBS, I began working for the Medicine Group in New Hope, PA, and am now an associate medical writer. The Medicine Group is a healthcare communications agency primarily working with pharmaceutical and biotechnology companies to develop and implement strategic scientific communication platforms for upcoming or existing medicinal products. For our various clients, I've been a writer for preclinical studies, clinical studies, and therapeutic reviews, and I've attended advisory boards and strategic meetings. Outside of work, I enjoy doing crafts, volunteering at the Bucks County SPCA, people watching, and spending time with friends. While public health ideally focuses on primary intervention, issues such as mental health and idiopathic diseases cannot generally be prevented, as the risk factors are not yet elucidated or are just not able to be prevented. For example, mental health issues are mainly consequences of genetics and unidentifiable triggers. These types of conditions are generally chronic, and due to the difficulty in preventing them, the focus is on appropriate treatment and management. Factors affecting appropriate treatment and management include identification and differential diagnosis, selection of appropriate treatment, patient education of self-management and treatment expectations, and routine follow-up and examination by healthcare providers. Clinical practice guidelines are the go-to resource for healthcare providers to utilize in caring for their patients. However, as more research is conducted, these guidelines undoubtedly will continue to be updated. Examples include the Diagnostic and Statistical Manual of Mental Disorders, the Rome Criteria for Bowel Disorders, and the majority of guidelines from the National Institute for Health and Care Excellence. My interest in public health is the focus of evaluating and improving current guidance. At the Medicine Group, I have participated in the development, distribution, analysis, and/or publication of 4 health surveys. All 4 surveys were targeted at a patient population and a corresponding healthcare provider population in order to compare insights from 2 perspectives of a specific healthcare issue. Survey 1 focused on obtaining pediatric assent in clinical trials, including appropriate ways for and challenges in obtaining assent. Survey 2 focused on how patients and their family and coworkers experience cognitive symptoms during depression, and how healthcare providers recognize and treat cognitive symptoms in depressed patients. Surveys 3 and 4 were conducted simultaneously by the same company and focused on chronic idiopathic constipation and irritable bowel syndrome with constipation, respectively, to continue to evaluate the entire experience of those conditions, including initial symptoms, treatments tried, residual symptoms, and disease perceptions. Results of these surveys demonstrated that, in general, patient experiences are not necessarily being taken into account when healthcare providers are making therapeutic decisions. In addition to surveys, healthcare data analytics is a valuable step in delineating current practices from more appropriate practices, which is crucial for improving overall healthcare. Real-world data and experiences are vital for aligning the perceptions and experiences of impacted individuals with current treatment guidelines. Health analytics is conducted by non-governmental organizations as well as numerous governmental agencies, and throughout history has helped to improve community health by implementing and enforcing guidelines, with examples including mandatory immunization for children prior to school entry, regulation of the environment to improve sanitation and decrease noxious stimuli, and motor vehicle laws regarding helmets, seatbelts, and other safety issues. The work that I will complete while obtaining an MPH will enhance my knowledge and experience in different areas of public health, which will help me to hone in on the future public health job that would meet my needs as an employee and will actually help communities rather than just pharmaceutical companies. Specifically, I hope to be a part of the evaluation process for guidance on mental health disorders and guidance involving vulnerable populations, including children, elderly, and minorities. Thank you for taking the time to watch this video.